Welcome back. So another medical giant in the Twin Cities is seeing new efforts for its staff to form a union. Today, resident physicians at the University of Minnesota announced they're filing to join one. Gordon Severson has more on what's been a whirlwind few weeks for local healthcare workers.
In less than 2 weeks, two major medical institutions in the Twin Cities have seen calls to unionize.
Burnout is a very real thing in medicine.
Dr. Nicole Lund is among 200 residents at Hennepin Healthcare who submitted paperwork to unionize last week. She says it's not uncommon for emergency residents to work 24 hours straight in stressful conditions.
The work it's busy, it's emotionally taxing. We see people having their worst days of their lives.
All right, we're at the University of Minnesota.
Monday afternoon, residents and fellows at the University of Minnesota also joined that call.
We're with the Committee of Interns and Residents,
hand delivering their union paperwork to the university's president.
We sent our list of names to the labor board this morning, which is a very exciting step.
Dr. Caitlin McLean is a second-year internal medicine resident at the U of M. She joined the call to unionize to protect her colleagues from being overworked and underpaid.
I love my job. We love our jobs, and we are sometimes, in order to take our best care of patients, we're pushed to our breaking point.
According to the Committee of Interns and Residents, a supermajority of nearly 1,000 U of M residents and fellows have signed on to join their union. A university spokesperson says leadership is aware of this petition and the university values its relationship with labor-represented employees.
Let's come to the table and let's have a conversation about what matters to us as a group.
This push to unionize is a trend that came out of the pandemic. According to the Journal for the American Medical Association, pre-pandemic, around 16,000 medical residents nationwide were enrolled in unions. Since then, that number has more than doubled, with about 20% of the workforce now represented. Dr. McLean expects that number will climb even higher in the coming years.
Being a doctor is such a privilege, and it's also very difficult. And we want to be able to show up and do it as our best selves.
So what's next? Well, union representatives tell me they're looking forward to meeting with the university's leadership team to figure out their first contract, and they're still figuring out the details of what that contract might look like. Gordon Severson, KARE 11 News.
We'll keep up with that. Thanks so much, Gordon. Hennepin Healthcare residents say their union petition is now being reviewed by the Minnesota State Labor Board. Residents at the U, they just submitted that paperwork, as you saw in the story, this morning, so a little bit further to go. We'll be right back.